If you could change one part of your body, or two, or three, what if that change could help you feel empowered and more confident internally? Today, I speak with a Singapore specialist that can help. Hi everyone, I am so lucky to have Dr. Martin Huang here with me. Dr. Huang, thank you so much for being with me.
Hi Laila, good to see you again.
So Dr. Huang, I can consider you as an expert.
Yes, I'm an expert in plastic surgery, that's for sure.
Fantastic. So I would like to also find out, where did you get your plastic surgery training?
Well, I did my residency in Singapore, and after I finished that, I went to the US and spent a couple of years there doing some advanced subspecialty training. Those are known as fellowships. Wow. And then after that, I came back to Singapore.
Okay, so what are the most common procedures that you perform?
The common procedures that we perform, that we have been performing for quite some time now, are eyelid surgery, and that would include the upper eyelids and the lower eyelids. These are very common procedures in Asia, especially amongst Oriental patients. Double eyelid surgery to create double eyelids, because many Oriental patients don't have a double eyelid crease. We also correct droopy upper eyelids. These are eyes that don't open so well, so the eyes look small.
Okay.
And then we also do a lot of eye bag surgery to deal with aging lower eyelids. Other common operations I do on the face include rhinoplasty. And then on the body, the commonest procedure we do is breast augmentation. Right. Yeah, as everyone knows, many Asian women are born with small breasts. So there's a great demand for breast enhancement and breast enlargement. So breast augmentation is one of the common and important procedures in my practice.
So we know that everything starts, always changing, right? So what is the latest development in plastic surgery?
Well, one of the most important recent developments and advances in plastic surgery is the advent of the 6th generation of breast implant, and it's the Motiva Ergonomics implant. So Motiva is the brand, Ergonomics is the model. What makes this new breast implant so important is that it has improved upon the characteristics of the previous generation of breast implants in a very big way. So the Motiva breast implant is a lot softer, it moves more naturally, and most importantly, it's also safer because it has an extremely low risk of capsular contracture. So capsular contracture is the main complication of breast implant surgery that we always need to tell patients about. So when we put an implant in the body forms a thin layer of scar tissue around the implant, and that's called a capsule. So it's a capsule of scar tissue. Now, if this capsule remains thin and soft, then there's no problem. But if it thickens and it contracts, then it will squeeze the implant, and then the breast will start to feel too firm, and the shape can even become a bit too round because the implant is being squeezed. And one of the good things about the Motiva Ergonomics implant is that it has an extremely low risk of capsular contracture, well below 1%, which is much lower than the capsular contracture risk of the previous generation of breast implants.
Wow, that's so advanced now.
Yes, so that's a major reason why we prefer this implant now.
Okay. So for example, if you do breast implants, and what are the risks, and what if something happens, what can you do?
Capsular contracture really is the main risk of breast implant surgery. Other than that, general surgical risks like blood loss, the risk of infection, those are all very low risk.
Okay.
So overall, it's a very safe operation, which partly explains why it's so common and popular. And now, with the availability of the Motiva Ergonomics implant, we've made it even safer because we have been able to reduce the capsular contracture risk to below 1%. And that's very important because if a patient develops capsular contracture, usually the only way to fix it is to have another operation. So if we can keep that risk really low, we are also reducing the reoperation rate, which of course ultimately is for the patient's benefit, because any patient would appreciate knowing that the operation that they're going to go through, the chance of needing another operation to fix a complication is extremely low.
What to expect pain-wise?
Okay, well, how much pain a patient feels after surgery, say breast augmentation for example, depends very much on the technique that is used. There are different surgical techniques in use. The one that I use involves direct visualization, and everything is done very cleanly and under direct vision. So there's no tearing of tissues, for example, especially tearing of muscle. Some breast augmentation techniques are done blindly. That means the surgeon isn't seeing what he's doing, he's feeling it. And you know, when you do that, it's not as precise. And so sometimes tissues get torn, especially if the muscle gets torn, then it can be painful. So in my experience, because of the direct visualization technique that I use, the pain that my patients feel is usually mild and well controlled with oral painkillers, which means that overall the recovery is relatively smooth and easy and relatively pain-free.
What about follow-up? Is it important?
For me, it is extremely important because when we first put in the breast implant, its position, its initial position is not going to be ideal because of swelling and tightness of the tissues. Implants tend to end up too high initially. Right. So it's very important to manage this during the patient's recovery. And we have ways of doing this, and to see the patients often enough so that we can monitor the position of the implant from being a little bit too high to being ideal, but at the same time not allowing it to go too low.
Correct.
Yeah, so I feel that part is really important. So I will usually see patients once or twice a week for the first month or so, so that I can really try and optimize the position of the implant, because that plays a key role in producing the best possible result. Okay. Now for patients, I did mention that we have quite a lot of overseas patients, right? Correct. So how do we manage that if they can't stay in Singapore for long enough? For example, many of our Indonesian patients, they are able to stay for about 1 week. So during that 1 week, of course, we can monitor the implant position very closely, but after a week, they need to go back. We will stay in touch with them, and we ask them to send pictures so that we can still monitor the position of the implant and instruct them on what they should be doing themselves, you know, to optimize the result.
So how to maintain benefits of surgery? What do one watch for?
For some procedures, like say breast augmentation, once you're fully recovered and everything is stable, it is pretty maintenance-free in the sense that the patient can engage in any kind of physical activity she wants, and no maintenance treatments are required. The only thing we really need to do is to monitor for capsular contracture. Okay. And as I mentioned earlier, if we're using the best implant that's currently on the market, then that risk is well below 1%.
What is that?
That is the Divina Imaging System, which is part of the Motiva Imagine Center that we are sitting in. So this is a specially set up part of my clinic that caters specifically to breast augmentation. And the purpose of this center is to optimize the patient's breast augmentation journey. Throughout this room, all the paraphernalia associated with breast augmentation using the Motiva Ergonomics implant. So we have samples of the implant, which the patient can actually hold in their hands and look at with their own eyes and feel with their own hands. And the Divina imaging system is actually a sophisticated 3D imaging system that captures images of the patient's breast, calculates their breast volume, which then allows us to correct discrepancies in breast volume if they are present. And it also allows us to perform virtual surgery on the patient, meaning the software can generate images of the breast after the surgery based on a certain selection of breast implants. So this allows the patient to visualize in 3 dimensions what their result would be like with this set of implants or this pair of implants versus another pair of implants. And it helps to validate their choice of implant, which would have been done earlier during the consultation jointly by myself and the patient using a different process called sizing.
So on that note, Dr. Wang, thank you so much. I learned so much, and I'm sure the audience agree with me. We learned so much too, right? So I'll see you soon.
Okay.
Yeah.
Thanks. It was
Thank
nice
you.
chatting with you.